Hello, I trust this message finds you well. We wanted to do something a little different with this video message to help get some more information out relative to our health insurance, our health care that's available to us, but also our health clinics that are available. I find time and time again that a lot of our officers, both active and retired, don't fully understand or appreciate the resources that are available through a lot of hard work through our FOP of negotiations to make those things happen. If you do not know, we have a quarterly health insurance committee meeting that allows us to provide input and feedback for our overall health insurance plan and resources. With that in mind, we wanted to take some time to share with you information about our marathon health clinics that are available to our membership and make sure that you understand some of the options there and what some of the requirements are for that. So I'm joined with a guest from the Marathon Health Clinics. If you could introduce yourself and just share a little bit about what are the health clinics all about for us.
Yeah, thanks, Rick. Kellina Avnet, Executive Client Advocate with Marathon Health. Marathon Health is an employer-based healthcare system, so we are not partnered with any sort of hospital entity or tied to a hospital system, if you will. We are completely agnostic from that. So we are an added benefit on top of your health plan, and we offer 7 health centers located around the 465 loop for a collective client or employer, such as the City of Indianapolis and FOP, who are on the health plan of the cities, and they have access to these 7 health centers located around the health center, Indianapolis loop.
Okay, so with those 7 health centers, is there any restrictions on which ones you can go to based on where you live or anything such as that?
Not at all. The beauty of our network system is that we also, outside of in-person visits, we offer virtual and telephonic. So if you are needing a sick visit, which is only $25 for those who are on the city's health insurance versus going to a typical healthcare system or a minute clinic, which can warrant up to $150 to $200 out of pocket. You can go to any of those conveniently from your home. So,
okay, great.
Yep.
So you don't even have to leave home to be able to participate.
Nope.
I have heard a lot of our members express concerns about that they're going to have to pay $125, $150 for an office visit. Many of them don't know they can just simply use the health clinics that are there.
Yep.
$25 for the visit and be off and running.
Sick visit.
All right.
Yep.
So one of the other things that most of our members don't know is that they can also do their annualized physicals through the health clinics as well. Can you share just a little bit about that?
Absolutely. Those civilian individuals who are on the health plan, so those who are non-sworn, are eligible to earn what's called a wellness incentive. So as long as you do your annual physical through the dates of December 1st through November 30th every year, you get an additional $500 of your HSA dollars contributed to your HSA accounts.
Okay.
And then for those dependents, should you have a dependent on your account or a spouse, you have an opportunity to earn an additional $500 into your HSA savings account should they complete their annual physical as well.
So that's for the non-sworn employees.
Correct.
But for our sworn employees or officers,
Yep.
they have the availability of where their full HSA dollars are available to them, but they still have the physical that's available to them annually,
Yep,
correct?
absolutely. Yep, so to head to a physical, go over any ailments or concerns that you have, any medications that should you be on and have any concerns with those, it is a complete head-to-toe physical.
One of the things that many of our members are surprised to learn about, they actually hear more about it from a lot of our retired officers who may be getting more prescriptions, let's say, is the availability of prescriptions through the clinic. Could you share some about that?
Absolutely. This is my favorite part of our clinic is that those who are on maintenance medications or those preventive meds, we are able to offer over 150 commonly prescribed medications free of charge to you all.
Wow.
So those are immediately dispensed in person, should you be in person, right there at the time of your visit. There's no need to stop at an additional pharmacy on your way home or wait for that to be filled another day or so. And then we also offer, should it be a continuous medication that you're taking every month, we offer a home delivery service as well. So those are shipped to you in a 90-day supply right to your front door.
Okay, so that was the other question that I had, is that some members would always ask, is it just a monthly service or can you get a 90-day supply?
You can get a 90-day, yeah.
Okay, that's great to know.
Yeah,
I mentioned that many of our active officers hear about it from our retired officers. Then I find that many of our retired officers who are members of the city-sponsored health plan they don't know that they can participate with the clinics as well. Is that correct?
Yes, so retirees are able to participate in or utilize our health services in any capacity that's offered, so in person, telephonic, or virtually, should they be on the city's health plan, so the pre-65 or those retirees.
Sure. Okay, that's great to know. I think more might utilize that. Now, here's what's interesting, and I share this with our membership. When we have that quarterly meeting on that Health Advisory Insurance Committee, that is representatives from the various labor unions that have a seat at the table to provide that input. We get real-time data in terms of numbers and utilization numbers. One of the things that I find is that IMPD is typically the lowest usage rate, but I think a lot of that has to do with not knowing what is truly available. My hope is that we are able to increase those numbers and see the greater participation. I think one of the things that would help greatly with that is you also have some additional options that are available, not just related to physical health, but you also now have an area that's focused on mental health as well. Could you talk some about that?
Absolutely. I think the beauty of having a worldwide pandemic is a really keen focus on mental health efforts.
Sure.
And really diving in and investing in those. We saw as an added benefit to you all and our other clients, patients, to add that free of charge or included in your already fixed per employee per month fee that the city pays for you all to have access. So our behavioral health services were implemented in the fall of 2020.
Okay.
So they've been available to you all since then. They are completely free of charge. There's no limits to any visits. Anyone who is on the health plan with the city and has access to our clinics, they have also access to our mental health services. They are licensed mental health counselors who see any patients ages 12 and up. So
Oh, really?
your dependents and your spouses are able to utilize that service as well.
All free of charge included.
All free of charge.
So with that, one of the things that we find on the behavioral health, mental wellness component is that a lot of our employees, they know of EAP services that are available, but they also are aware that oftentimes there's a limit of 6 visits for that. And my understanding is there's no limit.
Correct.
Through the clinic.
No limit.
Wow.
So you're able to go as often as you need. We oftentimes see that most mental health patients who are needing those services go on an average of every other week.
Oh, wow.
So when you think of an EAP service, that's only a month and a half or so, or 2 months, if you will. And you just have an expiration date already. So it kind of deters people away from utilizing their EAP service that's offered.
So
with us, you can go however often you need.
That's awesome. So 2 things with that is, one, it's voluntary and proactive on the employee's part.
Correct.
So it's non-reportable back to the agency or the city other than utilization numbers.
Correct.
And then on top of that, you can also, any of your dependents that are on the health plan and your children down to the age of 12, correct?
Yep.
So that's even lower than most do. Is that not right?
Yeah, so we typically see in the normal healthcare space that most offer those types of services at like 16 or 18 for
Right.
dependents. And so we thought that age was really indicative of where you start seeing those adolescent behaviors, mental health behaviors. And we do also offer group or not necessarily couples, but parent and adolescent counseling together.
Great. So I think that'll be something nice for our membership to hear of and learn of, and I would suspect you could see a greater utilization for that as well. So on that front, are they able to do the telehealth, mental health components as well?
Great question. So yes, all of those same services are offered in the same avenues as our typical healthcare services are. So in person, telephonic, and virtually. We prefer virtual or in person so we can see your face and get to know you better and build a relationship with you. But those telephonic services are available as well.
Wow, great.
So you don't have to leave your home.
Well, I know one of the things that we consistently talk about and that we're very committed to through the FOP is to try to figure out ways to continue to expand the usage of the health clinics, and that by raising our numbers, our eventual goal is to someday hopefully get toward where we could have some kind of a designated clinic, at least for public safety, if not specific to just police. Maybe even with police and fire.
Yeah.
Right now, though, for the clinics, if you go in person, they're public clinics, but it's 7 throughout the metro region.
Yep.
and you can utilize any of them at your convenience based on where you're
Correct.
working, living, or wherever you feel comfortable.
Exactly. Yeah, and that is exactly why we had put those clinics specifically where they are. They're conveniently off the 465 loop, off a typical popular exit.
Great.
Yeah.
Is there anything else that you can think of that folks should know about the clinics or that you want to share with them?
The one thing
I do want to mention is that with our services, we have a centralized member relations team. So they are a call center, dedicated scheduling and referral team. So should you need any help with any sort of healthcare questions, with your incentives, or just unsure of how to navigate healthcare in general, because we all, as normal laissez people, don't understand healthcare since that's not our field of work. But they are here for you to navigate through the healthcare system. So even if we can't see you for, say, a doctor of ours states you need to go to a specialist, you need to get an MRI. That's scary for a normal individual.
Sure.
Typically, you have to call around to many offices to see, okay, what's your price? If that's even a question that most people think of, and then you have to wait on hold forever to just get an appointment scheduled, which typically deters people away from, they give up halfway through that process. Our centralized referral team does all that legwork for you. We just typically will then, should you be at that appointment, say at your annual physical, and you're having knee ailments and they need you to go see a knee specialist, that referral would be placed that day, and a referral coordinator then calls you within 24 hours. They'll ask you top 3 preferences of where you would like to go based on your specific health plan that you've elected with the city of Indianapolis. And then be able to then come back with those options should they be close to work or home.
Awesome. So if somebody has not been to the clinic, they want to try it out, there's nothing that requires them to go for so many visits or anything like that. They can test it out. I'm confident they'll like it, find it convenient, and want to use it more often.
Absolutely.
And there's no requirement from the health plan to use the clinic. It's just a value-added component.
Absolutely.
Well, thank you for doing all this. I think it'll help spread word. We also want to include information, contact information, in case anybody should have any further questions or a specific need to identify.
Yeah.
If it's okay with you, we'll include that information on the video and down below as well.
Perfect.
All right,
Great.
great.
Thank
Well,
you.
as always, stay safe. Hope to see you at a roll call soon, and keep looking up.